Good evening, good evening, good evening, everyone. How are you? We are live this evening in education, in our group education and resources for adult children caring for their elderly parents. And I'm so super excited because I have a group of ladies that are awesome, that are experts in what they do in regards to senior care. And we're just going to talk a little bit with you tonight. We're going to be very candid. As you see in the live, our topic is about the good, the bad, and the ugly when it comes to nursing home long-term care. And we have a special guest with us this evening, Miss Jackie, and she's going to share her story and her experiences. We're not going to say what nursing home her mother is at. We're not going to name it, but we are going to share. She will share her story and her experience in regards to the nursing home, because a lot of times, we don't prepare for long-term care, right? We don't
No.
prepare, and then families end up in crisis mode, or something happens
Can you come outside right quick?
impromptu
I'm on a
or
live.
No, for one
dramatically to
second.
the
I'm on a
primary
live.
caregiver, and they just have no choice but the nursing home. And there are other choices, right? There's other ways of providing care, especially if you're planning for funding, because we all know that healthcare is expensive, right? That's just life. That's just what
Yeah.
it is. And Medicare does not pay for long-term care. I get it all the time. Oh, well, will the Medicare cover it? No, Medicare does not cover it. Will Medicaid cover it? Yes, there are some Medicaid programs that will compensate for long-term care. However, you have to plan for it, and if you don't plan for it, then you have to wait, right? So that's what we're going to talk a little bit about: the good, the bad, and the ugly. I'm going to introduce myself, and then I'm going to let my panelists introduce themselves. I'm Rebecca Middlebrooks with Agape Senior Solutions Placement Agency, your local senior care expert for senior living and in-home care. And I help families stay out. I help families keep their loved ones out of the nursing home while saving money on senior living, and also connecting them to in-home care providers and local resources, programs, and services when it comes to senior care. Okay, so Alexandria, go ahead and introduce yourself.
Hi, thanks for having me, Rebecca. I'm Alexandria, also known as the Care Girl. So all things care, but pediatric care and senior care as well. So I have a home care business alongside my brother, along with several other ventures in home health as well, as a 40-bed memory care facility and a 6-bed personal care home that should be opening any day now. So excited about that. So our mission is taking care of generations.
Awesome, awesome,
Wow.
love it. And Danielle, introduce yourself.
Hey, everybody. I'm Danielle. I have my own consulting business, DHW Senior Care Consulting. I speak specifically on nursing home placement, how that works, assisting families with the Medicaid process, from where to put their loved one, the application, all the way through. So thanks, Rebecca, for having me. Glad to be here.
Awesome, awesome. Thank you for being here, ladies. And Miss Jackie, introduce yourself.
Hi, I'm Jackie. I just basically learned trial and error on my own going through it. I've been here in Georgia for 3 years. I'm originally from New York. So some of the things are a little different in New York versus here. But I have a lot that in hindsight that I've learned or I'm still learning, things like that. So, but I was a caregiver for my mom for a while until I got sick.
Okay, so let's talk about that a little bit. Let's get into your story, Jackie, because
Okay.
like I said, I've worked at in the nursing home setting. I've worked the Alzheimer's unit. I've worked rehab as a CNA. I am a CNA, and there was a great experience for me. I started in the home care as an in-home care CNA, and then I transitioned to the nursing home, right? And I really, love that experience because, first of all, I love caring for seniors, right? I just have a caring heart. And then on top of that, I really learned my skill set when it comes to personal care, hands-on care, right? And knowing how to handle individuals properly, and starting off in the Alzheimer's unit, that was a big experience for me,
Yeah.
and you have to have that type of training. I really didn't have a lot of training. I learned on my own, but I think that's just one of my gifts, right? Caring for people. So it really came natural to me. And as I worked that floor, the Alzheimer's unit, I learned how to take care of Alzheimer's patients and how to redirect them and how to encourage them and how to not force them to do things, or if they're becoming combative or defiant, how to walk away and then come back, things like that, because they're just like babies, and it's a different type of care setting, right? And then transitioning from the Alzheimer's unit to the rehab, you have patients that are a little bit more independent. They don't have those that dementia or those cognitive impairments, but they suffered from a stroke or from a fall and things like that. And their goal is to get back home, right? And I love that about rehab, because for me, it was, I had that hope for them to go back home, because everybody wants to be at home, right? Yeah. Or either transitioning to, a safe place. They were getting better, right? And we know, as opposed to Alzheimer's, that disease progresses, right? So, with my experience, I've seen the good, the bad, and ugly. I've seen ugly caregivers. I've seen caregivers who don't care. I've seen caregivers who are there just for a paycheck. I've seen caregivers who work together as a team and they really care about our patients. We go in there, we, get them dressed, fed, it's a routine, right? But we get the job done. I had to work with, one caregiver to 15 residents, 20 residents, total care, not assisted living. I've worked in assisted living setting as well, where they're more independent. But I've, again, seen the good, bad, and ugly. And so I want you to share your story from start to finish in regards to, what happened, and, with you being a primary caregiver, and then what happened in your life where you just had to make a decision on the spot.
Okay, so born and raised in New York, my mom as well. And I believe around when I was 16 years old, I'm actually 40 now, but when I was 16 years old.
You don't look it.
My grandmother got diagnosed with Alzheimer's. Back then, there wasn't that much information like there is now, not a lot of research, things like that. So I just remember seeing her personality changes and, waking up in the middle of the night, the sundowning, things like that. So as a child, it's very not even a child, but even a teenager, it's traumatic to see somebody go from 100 to 0 or 0 to 100 and their personality just changing and just the crying one minute, then, okay, the next minute, then a glimpse of who they are for a second, then they're not. So like I said, I was only 15, 16 when she got really sick. She had to retire early. She used to work for the VA. And I remember her getting put in a home. My grandfather had to put her in a nursing home. I didn't know too much about that back then. I just knew we went to go visit her. And every time we went to go visit her, she would want to leave with me because her and I were very close. So she wound up passing away when she turned 70. But she was, at that point, she was like skin and bones in the nursing home. And apparently that nursing home wasn't great. So around 2014, I want to say my mom, around age 55 as well, was having some trouble at her job. She's been a TA in the school district for 25 years. Never an issue, never a problem, and they tried to fire her. So I stepped in, and I'm like, something's going on here. And at that time, my mom was living in an apartment. Her kids are all grown. I'm the oldest of 4. And my husband and I went over there and seeing things written down on Post-its to remember things. And we're like, what's going on here? Forgetting to pay bills, things like that, car insurance. So I got in touch with the school district, and basically I was able to get her to retire with her pension and benefits because they were just going to push her out. She had a psych eval, all that. The psych couldn't determine what it was at that time because they look at her that she's so young. So I took her to neurologists, a psych neurologist. I forget, is it called a psych neuro? neuropsychologist. I did all that. She had MRIs done of the brain, panel of blood work, and then I forget what it's called, a spinal tap that they do to check the spinal fluid and all of that. And they said it's early onset dementia, Alzheimer's. And they kind of basically go off your family history. Mm-hmm. So the way they were pushing her out of her job is the same thing they did to my grandmother. My grandmother retired early. All of a sudden came home and said she retired. It was very strange. And it's kind of almost like a deja vu thing going on. And I knew what happened with my grandmother. And I said to myself, I don't care what happens. I'm not putting her in a nursing home. I know how those places are. And I'm going to try my hardest. Everyone's like, put her in a nursing home. Because in New York, everyone's like, no one really does a lot of home care there. It's more you put somebody in a facility probably because everybody's working. Mm-hmm. Like you had said to me, Rebecca, some people don't have a choice. Mm-hmm. I was fortunate. I was disabled from work. I had a work accident at 23. So I was home. So I was like, let me take care of her until I can't. And then if I have to make that decision, I will. So at that point, she was still able to speak for herself. So I was able to get power of attorney over finances, medical, all that stuff. She wanted me to be in charge of everything. So I got all that paperwork done as far as, finances, things like that. Then we had to get her to stop driving at that point, which was hard because she was still a little independent, but just being a little bit forgetful. Mm-hmm. And I kind of feel like it's a double-edged sword because the more you take away, the more they forget that. So at that point, she only needed coaching. Like, okay, here's shampoo, wash your hair in the shower. Here's the conditioner, here's the body wash. And she could do it herself. No problem. And then she had a fall. And she must have tripped or something. And I wasn't there at the time. And because she fell and hit like a little bit here, she didn't need stitches or anything like that, but because of that fall, she got scared and didn't want to walk. So she started sitting a lot. I did enter her in adult day. What do they call that?
Adult daycare?
Yes. It was at it was a nursing facility, but they did adult daycare there. And what was happening is at that time she was with my sister, and my mom would walk to this facility when it wasn't even open, like on the weekend, because she wanted to go. And I'm like, I can't have her walking. So I brought her to another place that was 7 days a week, but she didn't like it. And then she started getting to that point where they're very combative, very angry, and they don't know why. It's like out of the blue. That, I have to say, was the most difficult because you're this person's caregiver and you have to take the emotion out of it, that it's your mother. Mm-hmm. And you're like, oh my God, I feel like I'm getting reprimanded again when I was like, 5 years old or whatever. I'm in trouble, and it's very, very hard, that part where, you have to realize this isn't your mom anymore. This is somebody else. And that part's very hard. Mm-hmm. Sorry.
It's okay.
And this is the person that's taking care of you your whole life. Mm-hmm. Your best friend. And it's almost like you got to be their doctor, their, bills, this, that, everything. You got to do everything. It's like you said, having a child. Mm-hmm. But I think it's also a little harder because the mood swings, the sundowning, mm-hmm. what medication's going to work, what medication's not going to work. Eventually, she had to, the only way in New York to get somebody, at least where I was on Long Island, to get like assessed, mm-hmm. you had to admit them to a psychiatric hospital. And that's another thing. There's really no psych places anywhere in hospitals. So I had to admit her there. And then they had to see, work with her, what medications are going to work, what's not going to work. So she was there for a while. And then once she got stable with the medication, the outbursts weren't as bad and, things like that. Mm-hmm. And then you just find little things that make her happy, If she's going to have a piece of chocolate, just give it to her, it doesn't matter at this point whether, it's healthy or not, Mm-hmm. One struggle I did find with her was that she had no problem eating with her appetite, but then all of a sudden I'm not hungry or I ate already. And I'm like, you didn't eat? Yeah, I ate already. That's when she started to like lose weight and things like that, because she would say I ate, and you can't force her to eat.
Mm-hmm.
So we're like, all right, what do we do now? But at that time, I have my nephew. I've been taking care of him since he was 2. I have custody of him. So he was, little helping me too. And then my ex-husband now. So my mom was living with us, and she wasn't walking, incontinent, but she could carry conversation a little bit here and there. And then I was going through a divorce at the same time. Mm. So that's how I came to Georgia. And in hindsight now, if you don't know somebody's going to be sick, or something like this, where I didn't know she was going to get that, and then you try to get, some kind of insurance that's going to pay for long-term, because I found out right then and there, oh no, they're not going to pay for this or the assisted living or anything like that. It's all private pay. And I want to say in New York, it was like $8,000 a month. Yeah. And that's not even a private room. Mm-hmm. And I'm like, how do people afford this? Like, you don't know if someone's going to come down with Alzheimer's at an early onset, It was just out of nowhere. And that age so young. Mm-hmm. So a lot of things she didn't qualify because of her age. Mm-hmm. And even though it's probably genetic or rare that people get it at a younger age, it also progresses faster when they're younger. Mm-hmm. Versus if they were like 80 and got it, or 70. Mm-hmm. So Google was like my best friend at that time, because, I would Google, what to do for this or what to do for that. My sister was a CNA for a little bit of time, so she would help tell me, like, move her this way or do it that way. Because I'm like, how am I going to get her showered if she's dirty or this and that? So we moved to Georgia. She was fine in the car ride, actually. I gave her some bubble gum. And she just chilled the whole ride down. Mm-hmm. Did it at night so that she could sleep. And then I want to say she stopped eating around, like, we were here maybe 2 months. Mm-hmm. I don't know if it was the change or what, but she didn't want to drink anything. She didn't want to eat anything. And I wound up having to put her in the hospital because she was getting dehydrated. I don't know what that was. She just didn't want to eat, or not enough to sustain. And it was getting harder. I did have a chair that lifted her up so I can get her stand up to get her dressed and things like that. Even her favorite foods, she wouldn't eat. I don't know what it was. I think she was sick because we had something viral going on in the house, and that might have made it worse. Mm. So she went to the hospital, and then I wound up going in the hospital. I didn't know what was wrong with me. I thought I was dying. And I'm like, what's going on? Why am I? So lo and behold, I wound up getting pancreatitis from a infection in my gallbladder. Mm. And I had to have surgery. They said, you got to stay in the hospital for a couple of days for the swelling and the pain to go down. Mm-hmm. And then you have to have the surgery. And I was like, well, I really can't do that. I'm like, I take care of, my mom. And she was actually like on the other floor. Mm. And the hospital was pushing for me to put her in hospice. Mm-hmm. And for me, at least in the sense, especially in New York, everyone thinks hospice is like you've got 3 months to live.
Right.
So as soon as you hear that, you're like, oh my God, she's dying.
Right.
And the doctor wouldn't let me take her home. He wouldn't even let me put her in nurse, nothing. I finally convinced him, if I put her in a facility, will you let me discharge her from the hospital? He said yes. Because I was planning on not getting the surgery, I'll just come back. And he's like, no, the doctor's like, you're going to have the episode again. And it's going to be worse. I'm like, okay. So in hindsight, I should have had a plan. God forbid something happened to me in a new place. Don't know anybody, no family, no nothing. I should have thought, oh my God, what if something happens to me? Who's going to take care of her? Mm-hmm. I actually thought about this today when you were telling me to speak. I was like, someone should always just have a backup plan just in case, because you never know which way your life's going to go. I didn't know I was going to have surgery. So I took, without saying the name, I took the first available where they said there was beds available, because there really wasn't much to choose from. I'm here 2 months. I don't know the area. So I said, from my house to where it is so that I could go there. Mm-hmm. Hardest decision I had to do to even sign my name on that, because at that point it was out of my control.
Mm-hmm.
And I didn't have control over it, and I had to kind of submit to this. So they assured me she'll be taken care of, will be great, don't worry, focus on your recovery. And that was the other thing. If I took her home, I wouldn't be able to lift her,
Mm-hmm.
even at the low weight that she was at, just because of the surgery. So about like 2.5 weeks later, I was able to go visit her there, but she was in the rehab area.
Mm-hmm.
That was nice. She had 24-hour care around the clock. She started sitting up, able to feed herself, even to walk. She was getting all kinds of care there, but that only lasts so many days.
Mm-hmm.
Then they went and took me to the long-term care area because I was still wanted to take her home, but I was like, I'm not going to have any, no medical equipment, nothing. Oh no, she'll be great. So we go to the long-term area, and I was like, this is your long-term area? I was shocked. And I'm just like, oh my gosh, I don't want to do this. They said, oh, you can let her come here, and then if you want to take her home once you're fully better, you can do that.
Mm-hmm.
Okay. So I do it. The first day they took, she didn't even, what is it? It was 80 days or 90 days that Medicare pays out for the rehab part.
Mm-hmm.
It wasn't even at that, didn't even go that far. They already threw her in long term. As soon as she went into long term, she lost physical therapy, speech therapy. She lost everything. And she was sitting up and being able to be functional again. They left her there to basically rot. She started getting bed sores. I walked in and the food tray was sitting there, nobody helping her to eat. And I'm like, are you kidding me? Like, somebody needs to assist to feed her. Oh, well, we really don't have time. I'm like, you don't have time. So that's where it started to go downhill just from there. When she was admitted, there was so much staff there to, put her in a bed because she's a 2-person assist. And it was just, it's been a nightmare ever since. It's always something. Now, I know no facility is going to be perfect. As long as they're fed, as long as they're clean, as long as they're not having bed sores and just their basic needs as humans are being met,
Mm-hmm.
I think I can rationalize and saying, okay, this is okay. But because that's not even being met is where I have the issue. When I go in, I always take pictures of everything, of how everything looks. At one point, I don't even think she was getting her medication because she was crying a lot of going on. And I said, she's anxious. She's got really bad anxiety and she's nervous and scared. So that was June. By Labor Day weekend, she had 7 falls. Now, in my mind, I say, if somebody's not mobile, how do they fall 7 times? I think that's a problem. I understand there's a lot of falls in nursing homes, but I'm thinking somebody that's in a wheelchair or something, or, that can get around. 7 falls. A couple of them, they called me in the middle of the night and said it was no big deal. She bumped her head. She's fine. Okay. And then I get a call from the nursing home that she's going to the hospital because she fell. That was in 2019 on Labor Day weekend. So maybe that Friday. She's not bleeding. Nothing's wrong. Okay. They said, okay, I'm going to be there tomorrow. Then I get a phone call. She's in the hospital. I said, why? She fell and hit her head and she needs to be checked out. And I'm thinking to myself, didn't she just fall yesterday? Like, I was actually on my way there. So I went to the hospital and I can't even tell you what I saw. Like, I can tell you, but the pictures are horrible. So she had a wound from here to here, completely split open, and no skin or anything like that. Meanwhile, she only weighed 77 pounds at the time. I could not get a story of what happened to her. They did put her in the jerry chair a lot, and I'm like, from the jerry chair to the floor is really not that high. with that kind of force, with someone being 70 pounds, how can they smash their head open to where their skull is completely exposed? It didn't make sense to me. It didn't sit well. Nobody knew anything because the nurses sit at the station there, and then they just put all the patients right there so they can watch them, because God forbid they get up. So I saw the other injury she had prior, and she had 3 staples. The same doctor did the stitches, and I said, "What is all that white, like on her forehead?" Like, I don't know. He's like, "That's her skull." And then I had the nurses handing me nursing home abuse and neglect forms saying something is wrong here because whatever they told the hospital, it wasn't making sense. And I still couldn't get an answer. She was also on hospice at the time with Kindred, and the nursing home never called Kindred to let them know that she was in the hospital, and they were furious. And then when they actually saw what happened, they were like, it was bad. I think it also made it worse, my mom having multiple head injuries when you have Alzheimer's, it not that speed it up, but it just made it worse. With her, I couldn't get her to calm down in the hospital. I had to beg them to give her something because she was just like freaking out, didn't know what to do. She didn't know what was going on. And then she's probably in pain. I mean, who wouldn't be? The other thing was horrible was that she was at the hospital in men's clothing with other residents' names on these clothing. Probably not a big deal to everybody, but to me, I'm like, you can't even put her own clothes that I go and spend money on and spend my time sewing in her name or writing it in and making sure it's all there, and you can't even send her to the hospital in her own clothing.
So you experienced a lot
from
the time she was admitted,
yes,
even to now, right?
Yes.
And it's sad to say, but it's very true. It happens all the time. All the time. It's a revolving door. So thank you so much, Jackie, for sharing your story and what you've been going through, sharing your mother's story,
Right. Yeah.
And I wanted to talk a little bit about going into planning for this again. So, a lot of times, like you said, you didn't know that there were Medicaid waiver programs that will allow her to stay in a smaller type setting, such as a personal care home, which Miss Alexandria is the co-owner of 2. She's not a Medicaid waiver provider. It's only private pay, but there are personal care homes that are Medicaid waiver providers that are able to provide hands-on personal care, that able to monitor their residents closely. They're able to, administer those medications and make sure that, physical therapy can still come in and do physical therapy. Home health services can still come into the home and do physical therapy, occupational therapy, and things like that. And a lot of families don't know that there are other options. Right?
I just get that letter from Medicaid or Medicare saying, she's no longer eligible for physical therapy.
Right.
That's, and Medicare. I didn't even know personal care homes. In my mind, I think of like if someone's adult and they have maybe cerebral palsy or things like that.
Right. Like a group home.
Yes.
People think of it as a group home.
Yes.
Right. And no, it's not a group home.
Yeah, I didn't know that.
They provide 24-hour care. They 3 meals a day, snacks, activities, and like I said, it's a smaller setting, so they're able to spend more time with each resident, right? It's like a home setting, right? So I'm gonna let Alexandria talk a little bit more about personal care homes and the services that is offered there, because she is a co-owner of 2. Also talk a little bit about your memory care, Alexandria. They have a wonderful memory care in Smyrna, correct? And it offers services, and it is affordable. And that's the other thing. A lot of families don't think it's affordable. you can get a semi-private, I'm not going to say a lot, but you can get a semi-private bed for $2,500, a private room for $3,000. So, with
that's what I have to send them before they'll even pay anything.
Right. So with the pension and the SSI, and then sometimes families have to add a little bit extra, but it is affordable. It's not, $5, $6, $7, $8,000, right? And then if they prepare for it, then they're able to have that funding to be able to pay for private pay. And that's the key thing, is preparing and educating yourself. So, Alexandra, talk a little bit about your services that you offer at your personal care home, your memory care, and then also talk a little bit about in-home care, because all families don't want to transition their loved ones into personal care homes. Some want to keep them home. And there are different types of resources to keep your family in the home as well. You have VA aid and attendance. You have Medicaid waiver, again, for in-home care, private pay, long-term care insurance, death benefit, life insurance, death benefit. So talk a little bit about your services.
That's the other thing too. With nursing homes, they'll say they have a memory care unit. You go there, they don't.
Yeah. Great story, and it really touched me. I'm very familiar with the feeling, because my grandmother was neglected in the home several times. That's how I got into this field. My grandmother's a very powerful woman. She has a street named after her in Greenville, Mississippi. She was the first Black congresswoman in Greenville, Mississippi. So she even though she got MS at an early age, she still is very verbal. She'll call defects on you in a minute. She's a very strong woman. So basically, I started a home care company back in 2015, dedicated to her. She's still living to this day. But I got a call from my mom about a year ago saying that grandma's not doing good. We're gonna move her to Memphis. That's where my family's from as well. And I was like, okay, y'all moving her in with you guys, That's what I asked, because I didn't. That's my first step is, I always say, it's best to age in place. That's gonna be my first recommendation. So I said no, nobody can stay home with her. So I was like, all right, where y'all putting her? This is in my mind. I already knew they was gonna say nursing home, and I said, okay, you place her there, she's going to die. Because I know Memphis, and they don't really have that many quality places like. But Danielle, is it Danielle? Maybe she has more experience. Maybe she'll know more nursing homes here. But in Memphis, it wasn't really any. And I always say, hey, if they can stay home, get a company like ours to come in, take care of that person. So COVID hit, and we weren't able to see my grandmother. We were able to see her through a window, and we saw a decline. The time I visited the facility, it smelled like urine. So that's me coming in. I was like, this is bad, and we were able to see her through the window. We finally got in there. She lost 80 pounds during COVID. She lost 80 pounds during COVID. So I was right. So we had to fight tooth and nail to get her out of there. She's supposed to be getting fed through a tube. They was trying to spoon feed her. She could not swallow.
Because of the MS, right?
Yeah, well, she had a surgery done, and they were supposed to do a whole thing, and it just, all COVID just stopped everything. But I guess they thought she could eat through. No, she couldn't. So I told my mom, I said, I don't know what y'all got to do, but y'all gonna have to get out of there, because she's not gonna make it.
Right.
So they ended up getting her out. My mom actually retired early, which was a blessing, and was able to move her in with my auntie. And they all, they're all like doing shifts. They got some people coming in as well. But she gained her weight back. Okay. She's doing good. She's taking trips out of the house. She has a wheelchair. She's gonna come out here one day, and I have a special doctor I want her to come see out here in Atlanta. But just way better. But everybody being involved is so important. And I know it's a lot on just that one caregiver. So the next option, I would say, if someone can't retire, it would be a personal care home, just like the 6-bed we're opening in Mableton, because you have a dedicated caregiver, maybe one or two, to that parent. So how that works is you reach out to a placement agency like Rebecca's, and we will be on her list for the family, and you'll come out to her and sign up for care. And the way that we place our caregivers in the home, we do, of course, you do your background checks, you do all of that, but we don't accept everyone. You have to have a heart for this. This has to be something that, you know, is a part of your life, and you really want to do this. Because if you come in immediately saying how much I can make, this and that, like,
yeah,
you know, it's really not. And I hate that the field doesn't pay enough for some people. So we kind of look for retirees. We look for students who are medical. So we kind of have a criteria versus, you know, some of the ones that are kind of care hopping, I would call it, because they do it to the facilities as well. So yeah. So
every 2 months is a whole new staff, or there's no staff, and I'm like, what is going on? Every 2 months.
And what's happening is, you know, it's a huge burnout because those people aren't making enough money. And then, you know, but they're taking all of mom's money. So where's all the money going? You know?
Exactly.
So, yeah. So, and I've dealt with memory problems. You know, you're very familiar. Things that you're saying, it comes back to be some clients we dealt with in the home, you know, that got diagnosed at an early age, you know, the Lewy body and you know, the dementia, the Alzheimer's early onset. And I've seen it to get to the extreme point. So this is why we're happy to acquire this memory care facility in Smyrna, but right now it's under extreme management. We're going in, we're changing a lot of things because a lot of those people, you know, weren't being treated up to the standard that we treat our people. So we're taking our time before we even accept new residents because it's already 80% filled. So what we're doing is we're creating a culture. We're basically retraining staff because memory care is very important. And if, like you said, everybody's working, everybody's doing this, everybody is not prepared for, you know, this happening to mom or happening to brother or happening to uncle. So we definitely should start preparing earlier, I would say, financially for, you know, that parent may have a fall. This might happen, that may happen, but a place like a memory care is good for parents who or those loved ones who have those issues, and of course they can't age in place at home. So a good one I would say would be they have activities, they have, you know, the therapies, they have everything there, and you guys can come in and out to see your loved one, because a lot of times when they try to shut you guys out, other than for health reasons, it's because they're not getting the care that they actually need. So that's crucial for me, coming into this new space of the memory care and even the personal care home, because we also have to think about, you know, personal care homes, you can't be total care as well. So that's when you have the conversation, hey, you know, dad or mom is total care now. Either you get an extra caregiver to come in, it just depends on your state license, or you move them to another place that is total care. But our goal is for that parent or loved one to you know, get some type of function to where they have a quality of life.
See, that's the thing. Once you're thrown there, you're left there. There's no quality of anything, and then you're just declining more, and that's what's happening. And now, since COVID, they've reopened. I mean, they shut down a couple of times, but since I've been there, it's even worse than it was before. The odor, even with your mask on, is so bad. It's like you can't even think of anything else, you know. And then I'm in there scrubbing her floor in the room and her bed, cleaning everything up, you know, doing the laundry because I don't want them doing it. And it's a nightmare. I'm not there to visit. I'm there to make sure that she's not hurt.
And you're advocating for her.
Yeah, right. Because and it's not like I can't even visit her. Like I can't even like just sit there and talk or just look at her because I'm worried I have to inspect her body, her hair, everything. You know, I found they used the end of the glove, you know, that hard part. They're using that to tie up their hair.
No, indeed.
God forbid one of them ate it or put it in their mouth or something. And when I brought it up to a CNA, oh yeah, we do that when they don't have hair ties. I'm like, well, if you told me I'm here all the time, I would have brought it. I didn't know.
Yeah, it sounds like I hate that you're going through that, and I
Mm-hmm.
hope that
I want to get her out of
I would
there.
even send some resources to Rebecca about some homes I know that is it Medicaid or Medicare.
Well, I have to
It's
send her Social Security, her pension, and her disability all to them. So they're
oh
getting a
my
bunch of chunk
goodness,
of money first.
wow,
And I said, "Where's all this money going?"
yeah,
And I don't know.
yeah.
I'm sorry to cut you off. And
Oh
I've
no,
got
you're
a
good.
question. You know how and I don't think it's regulated in all states, but I know in Georgia there isn't a minimum of how many CNAs to patients, and that's an
Mm-hmm.
issue because I was doing some research on it, and I'm like, it tells him that the nurse has 11 minutes with a patient because they could have 70 patients to one nurse.
It's
That's a
it
lot.
a nursing home is regulated now what the facility does compared to
Right.
the regulation, times a day, all of that
But
kind
I
of
mean,
breaks down those minutes.
the
And
fact
that
that
would be very
Medicare and
frustrating.
Medicaid pay all this money out to them and you could have like 70 patients to one, like that's terrible. How is somebody going to get any care?
Mm-hmm. Right. So that's why I say a lot of times, and we're going to let Danielle speak, what signs to look for when looking for a nursing home. Talk a little bit about those regulations that you were just speaking of, Danielle. How to look at the ratings and things like that. Right. Because
Right.
that's her expertise. Danielle, go ahead and get into that.
Yeah. So Jackie, first off, I am super sorry. I wish I had met you years ago, in regards to what's going on. Similar story. I had to move my grandmother from Louisiana to Georgia. She was also suffering from Alzheimer's and dementia. We had, family involved. My aunt, who was the primary caregiver, passed away in 2014. And so that kind of started the cycle. And we were like, okay, let's figure out what's going on.
Right.
But it wasn't until I think my grandmother had a fall and I got a call saying you need to come and get her. So between my mom and myself, that was the decision. I was working at a nursing home at the time. I was a social service director. And I said, okay, I'll come and get her. And that's what I did. It was a hard decision, because her dementia was the paranoia. It was somebody stealing my stuff. They're coming in here when I'm not here.
All the
And
different
so
stages of it.
all
Yeah.
of the different stages, right? And at 97, I was like, well, it's dementia, so I was already preparing my family for let's, take the emotion out of it. These are the
Hard.
things that we need to go ahead and do. But I was only able to do that because I was already working in the field and I was watching the family dynamics happen. So we moved her here, I think January of 2018. I was finishing up my master's, transitioning into another position, and moved her here. 3 weeks later, she had a stroke, and about a week later, she passed. And I went through all of those same emotions. Did the facility do everything that they were supposed to do? Did I miss something? Should I have been here more? Even though I worked at the facility, I trusted all of my caregivers. I trusted my nurses as well. But still, it became personal that, hey, this is my grandmother. You guys should have treated her as if she was yours. And I had to say, you know what? They're not here to care for my grandmother like I would. They're supposed to. I would think they would if you're working in a field of seniors. You would have that type of heart, but everybody doesn't have that. And so sometimes you have to take a step back and say, like you said, the bare minimum: keep them clean, keep them fed, keep them alert, keep them involved. Yes, that's what they're supposed to do. And the extra mile is providing the care and the attention to the detail, especially when families cannot, because a lot of them don't have families like us, who understand, who've been through it. And so you see it with different eyes. So coming from the nursing home setting, I'm grateful that the nursing home that I worked at was a good one, so when families came into our building, I always said, okay, what does it look like? What does it sound like? What does it smell like? What does the food taste like? And what's that feeling you get when you walk in? And if the first thing you smell is urine or feces, okay, maybe someone had an accident and we didn't get to it, But if it punches you in the
No, it's
face,
like a wall where you're like, as soon as you get off the elevator, you're like,
then you should be like, yeah, no, thank you. I'm not going to continue with the tour. You know, if that's good. All right, come at a mealtime. You know, when everybody's sitting down at a meal, when the residents are coming out, you're looking to see what they're dressed like, if they've got their glasses on, if they've got their lipstick on, you know, are they still in their pajamas? Are they in a robe coming to the meal? If you see 5 people in the dining room and everybody else in their rooms, something's up. You know, then that means that they don't have the care and the attention, and they're leaving the residents in the bed, you know. So those are a lot of the things that I talk about when families are looking for nursing homes, when that is the only option. You don't have family close by to be able to take someone in,
right.
when you don't know, or when you have a total care. You know, as Alexandria was saying, a lot of the personal homes cannot take a total care because you're needing equipment now to lift
Right.
them, and you need to be able to store that somewhere for the residents. So it does take work. You know, it takes that time of, am I ready to do this financially? Because you're going to have to look at finances. Jacqueline, is your mom Medicaid?
What was it called? I had
Yes.
to open up a qualified income trust.
Okay,
So I have
and
to
then you
put the
applied
money in
for.
there. Then I
Mhm.
send it to them, and then
Mhm.
Medicaid and Medicare pays out.
Okay, so Medicaid
So they're
pays.
getting more money from her than other residents.
Okay, so but regardless, Medicaid is paying the same rate for everybody. Okay.
They are?
Yes, Medicaid is getting the same rate for everybody that comes in. Medicaid is the resource of last resort. So that means if you have money, you have to pay for your living.
Yes.
If your mom, you know, just like when we move into an apartment or we move into a house, we have to pay lights, water, we got to pay for food.
Right.
And you're also paying for somebody to be there 24 hours a day to provide care. Be it a nurse, nurses have to be there 24/7, you know, so they're going to have either those 8-hour shifts, those 12-hour shifts. Same thing with the CNAs, based on the capacity and based on their census determines their CNAs. Now, of course, state regulation says 12 CNAs to 1, but at certain hours of the day,
12
say
CNAs to 1 patient?
yes. No, opposite. Take that back. So 1 CNA to 12 residents. I apologize. I said that backwards.
Is that
So
regulated here?
It is Georgia state regulated.
Because
So
I tried to look it up today and it said 30, and I'm like, 30?
No.
And I'm like, that's why they only have 2 CNAs to 70 patients.
Yeah, no. Now, nighttime shifts, maybe you're 11 to 7 because everybody's going to be in bed.
Okay.
You know, you can probably, you know, if you have a census of 120, you may have only 12 CNAs within the whole building. You may have less than that because there are the shortages, and you have those that are already sleeping. You know, those are your lighter shifts. Everybody's not getting up and going to a meal, you know, and so they may overlap it. And every facility is different. Even, like I said, even though it's state regulated, every facility kind of works that a little bit differently. Because when the state surveyors show up, everybody's where they're supposed to be. And I'm an advocate for families and residents. If you see something, say something. I don't care what it is, who it is, be it the nurse, the therapy department, the administrator. I always say, stay involved.
They don't like when I come in there.
Okay. And they should not like you coming in.
And they're nasty. And I'm, you know, the way they're treating her, I give them a chance to rectify the situation. You know, I try to give them that, you know, because you never know. But it's not going anywhere.
But this is your loved one. You have every right to call the state. You know, you have every right to call the long-term care ombudsman and say, hey, such and such and such is going on. And you have every right to now say, I need you all to assist me in finding another facility. I have the right to move her. These are the places. Yes, I want her to, if you find the places, and that's something that Rebecca and I can definitely help you with in regards to if she's needing total care to where a personal care home is not suitable for her.
I tried to move her twice. They blocked me from moving her.
Why? They should never be able to block you from moving her.
I think it's because I have a lawsuit from when the incident when she fell.
Then you have even more right to do so. Now, I will say this, because you have that, other
It
facilities,
scares off other facilities, right?
it does. It does. You know, but still the facility also would need to speak to you and say, tell us what's going on, because they also inherit all of that as well. And I've been there. We've taken in residents at the facility that I was at before, pending lawsuits and things like that. And so we're also underneath the microscope, even if we're doing everything right.
Okay.
Things can still happen.
I've tried so many times to get her out of there, and they keep stopping it. I tried to get her medical records, even though I'm her POA and I'm entitled to it. They said no.
You are.
Adult Protective Services tried to get her records. They said no to them.
Yeah, I mean, then you definitely have to take it to the next.
I don't know. I'm kind of like stuck. Like Rebecca
what's
said,
that next?
My hands are tied.
So that next step would be the administrator of the facility, and then whoever is their corporate office, that would be your next step. Of course, definitely calling the state and your local ombudsman,
I did that,
because they are definitely your advocates. The facility is not allowed to hold this information. If you requested it properly, even if it's 1,000 pages and you said, I will pay the 30 cents per page, they have to provide you that document. That is your legal right as her power of attorney to have the full thing.
Right.
You know, everything's electronic now. It's really not hard.
They don't have corporate there. It's owned by a group of doctors. So right now they're trying to go to arbitration, but my attorneys don't want to because they want a jury to see what happened to her. And they know that we would win, you know, and my thing is I want to get her out of there.
And even your lawyers should be able to request that documentation without, you know, retaliation. And that's also
that's the other thing. I get afraid that they're going to treat her even worse because of it.
And that's a natural fear. But that still does not give them the right to do so.
Right.
So, you know, if you want to move her, you have the right to do so. If, you know, and other facilities need to know the full story. I always asked when I was the admissions director as well as the assistant administrator, tell me the whole story. I don't ever want, you know, anybody to be in a situation where they don't know, and because they don't know, they can't prepare themselves to be their best.
Yeah, I'm willing to be honest and say, hey, you know, I have a lawsuit because of this or whatever. And, you know, for 2 months, I didn't give them a dime because my mom was in such bad shape. She has scars all over her arms, her head, her feet, everywhere. It's horrible. And then it's like, you know, do I take her home? But then I don't want to take her home. And then I do something wrong because I'm not a medical professional. And God forbid something happens, that's on my watch. Right. So I'm kind of wrestling with the fact is this place is going to kill her too.
Yeah. And I think a personal care home, because it is smaller, you know, and if those options can be provided financially, and that's something that, you know,
I'd rather give that money to somebody that's going to, you know, at least not love her like me, but if it was their mother, because you know what, like everyone's like, you should go into this field. I don't think I could handle it because I would give patients so much attention, or I would cry because I see other residents there. A woman was on the floor begging for help, and I ran and got somebody, and they didn't care, and she just laid there. Like, it's just horrible.
Yeah. And there are some personal care homes. If she is on hospice,
she's not.
What I'm saying, if she's on hospice, then there's some new state rules and regulations where a personal care home can accept total care if they're on hospice.
Oh, okay. Yeah, no, they said that she didn't qualify anymore. They took her off last July. She was 77 pounds. Once she came off hospice, she started gaining weight.
Okay.
So now she's like 119.
Okay.
That's the only positive.
Okay, but there are other things in her medical condition that could still qualify her for hospice.
You know, that's what I shared with you. Did you speak with Dr. Teeter?
Yes. I spoke to so many people this week, and I was driving on top of that. And like, when I go, like even my husband said, he's like, when you go see your mom, he goes, you come back a basket case. He's like, you know, and I'm like, well, I can't not go because COVID, you know, made it worse where she didn't know who anybody was, you know. I mean, she knows it's me, but it's like I have to mentally prepare almost, and then come home, and it's horrible. It shouldn't have to be like that.
Right.
So, Jackie, I want to let you know that we are here for you, and we thank you.
I did speak to Dr. I think I did.
Yeah, and we want to thank you for sharing your story.
Yeah, definitely.
And
it's still ongoing. There's a whole bunch more, but it's still ongoing.
I know, but we're here for you. You have resources now. And
I just don't want to feel, with all of you guys hearing some of it, am I stuck with her there? Like, is she stuck there?
You're never stuck there, no ma'am.
Because I know other places have wait lists and things like that.
I mean, you may have to travel a little bit further.
I don't even care if I have to travel an hour at this point. Because you just want someone to be taken care of now.
Right. So I would say for you, Jackie, to still do your due diligence, do your research, go on to the Medicare.gov website.
We did that today,
and they have nursing homes listed. You can put it in through your zip code, and then you can also do their quality measures because those are state regulated. So state surveyors come in, and so you can look at their quality measures, you can look at their health scores, you can look
at
what
I did today.
Their staffing ratios, and then kind of compare and contrast. And those numbers get a little funky because I've done it myself, and I'm like, what is 11 minutes? But you have to think in a big scheme of 100 or 120 residents, how that balances out from them passing medications, keeping hydration, and then providing the care. So don't get caught up so much in the numbers. You wanted to paint a picture for you, and then you call and you see how that tone is on the phone when you're able to get an admissions person, when they're asking you questions, if they're warm and fuzzy, and then you say, okay, I'm going to keep them on my list and keep going. I don't want you to get frustrated and say, look, this is just the best that we're going to have to do. And that's not fair for you.
It's so frustrating. Right. And I'm like, you got to keep fighting. You got to keep fighting.
Right. And if you stay positive, I think that will help her. That will help the situation. If the facility constantly feels like you're there to watch and pick, you know what, this is where we are. It's not the best place. It's not the best scenario. No, they're not providing the care, but hey, I'm able to be here. If I need to wash the clothes, we're going to wash the clothes.
Oh yeah.
And right. Yeah. But that energy as well also plays a role. And so I want you to take, okay, this is where we are right now. This doesn't have to be the final. I'm going to keep doing what I do for my mother because I love her. And we're going to keep pushing. I don't want you to feel like, well, they're watching me, they're doing this, they're doing that against you. They've got their own issues as well. Right. But it should not result in neglect and abuse of your mother.
Okay? I don't think anybody's malicious. I think it's more of everything in the backbone of these places are CNAs, and they're overworked, they're understaffed.
Yes. I agree.
And the pay isn't great.
Right.
And if you're working these people to the bone, what are they're doing the best that they can with what,
Right.
And that's how I kind of feel. And I mean, this place has changed executors in 3 years, like 5 times. That's a problem. And nobody can get it together.
Yeah.
So
yes, thank you, ladies. Thank you, Jackie, again for sharing your story, and thank you for your expertise. Thank you for your encouraging words, ladies, and sharing your expertise and helping her through this process this evening. And again, Jackie, we're here for you. I'm going to give you their contact information. If you would like to reach out to them and set up an appointment to talk one-on-one as well, and go a little bit deeper into pushing forward with getting her transitioned out of that nursing home. Okay.
Yep.
So thank you, everyone. You all have a blessed evening. I hope that this story was able to help someone else. That's what it's all about. That's why we came here live this evening, to share a story and be a resource and help other families who are going through this same process, and know that you're not alone, and that there are other solutions and options out there, and that there are people who really truly care about seniors and helping families get through this process, because it can be overwhelming, gut-wrenching, stressful, all the above, right? Yeah. But we are here for you. So you all have a blessed evening, and we'll see you again on the next live. Good night, everyone.
Good night.
Good night.
Good night.